Yeah. They've tried you already? Yeah.
Good afternoon. Yeah, let few people sit. There are seats in the front, if you would like. Great. I think we're going to get started. Thank you, everyone, for good afternoon. Thank you for attending our session and welcome to our online audience. My name is Caroline Delaire with the Acquia Institute. Acquia is one of 10 consortium partners in the USA Ghana Enhancing WASH project, which is led by Global Communities. Today's session will talk about the gap between the cost of water and sanitation services in rural areas and consumers' willingness and ability to pay. And our presenters will highlight a few strategies to bridge that gap. We will start the session by a few presentations by Global Communities, Safe Water Network, Acquia, Water4, and Deloitte. We will continue with the panel discussion, which will be your opportunity to ask questions to the panelists. Then we will break out in 3 groups to discuss specific strategies to address the financing gap. And finally, we'll report back to the main audience, to the main group, and have closing remarks by Nikki Benker from USA. So with that, it's my pleasure to invite Alberto Wild from Global Communities to kick us off.
Thank you, Caroline. Good afternoon. Good afternoon, everyone, and thank you for attending our session. I will try to make it as entertaining as possible. I know after lunch is difficult. Well, I'm based in Ghana. I'm the country director for Global Communities, Chief of Party for the Enhancing WASH project. And for the past several years, I've been living in Ghana. So that before starting, I would like to acknowledge the presence of some key individuals here. I would like to acknowledge Madam Ellen Getchi from Ghana Education Services. She's here with us. Madam Charlotte Ajay from the Ministry of Sanitation and Water Resources. And also Stephen Checheble from Ghana Water Company Limited. Thank you for attending our presentation. So I will start by talking about the USAID Enhancing WASH activity program. This is a project that has a duration of 5 years. Started last year in 2021 and is going to go up to 2026. The funding available for this fund is $39.5 million, with a cost share coming from the private sector of $6 million. The areas of intervention are on the map on the left, which are 6 northern regions in Ghana. So as you can see, we have half of the country that is being covered by this project. The prime implementer is Global Communities, and we have 10 other implementing partners, which have been very selected in a particular way, because there's something that each one of them do very well that will contribute to this project. So the consortium is working to achieve 4 main results, of which in this presentation we will focus on the result number 4, which has to do with water service providers adopt improved management, operational, and finance models to enhance WASH programs. It's a behavior integration-led approach that focuses on outcomes and not outputs, as the previous project that we implemented was. Based on the previous learnings, the Akwaya Institute is going to lead the applied research with us, with Global Communities and its partners for the government of Ghana. For the topic of this presentation, we will research on questions 1 throughout number 4. I will not read them to you. Now, let me tell you a little bit about the topic of this presentation, which is closing the financial gap in WASH service delivery. I will focus in more on the sanitation, and my other colleagues will be focusing on the water side. So the enhancing WASH approach, in the first year of implementation, we emphasize on the behavior profiles, as well on the training of the stakeholders to bring everyone to the same page. In the next 4 years of implementation, our focus will be on the learning agenda. We will use this methodology to better understand the consumer behavior and motivators related to services, while pinpointing feasibility interventions that can leverage these factors to give consumers a voice in identifying local and sustainable solutions to paying for water and sanitation services. Enhancing WASH will conduct a consumer research to identify what households are willing and able to pay for different products and services. As I mentioned in my previous slide, the Enhancing WASH program approach was based on the learnings of WASH for Health, which ran from 2015 to 2021. As part of the learnings, we observed that communities that build their latrines with traditional local materials were more likely to fall back into open defecation as compared to the latrines that were built with more durable and sustainable materials. Obviously, the people who had access to more durable and sustainable materials were people who had financial viability or access to finance services. We also concluded that insufficient financing for sustainability operation services will jeopardize the sustainability of the water systems. Therefore, an alternative solution needs to be put in place. On this next slide, on the left side, you can see a pyramid that shows the different levels of income of the poor people. So the extremely poor that are making less than $1 per day, the poor that is $2 per day, the middle income that is considered those rural areas that are earning less than $10 or less, and what we consider the wealthy in those communities that are earning more than $10 per day. Of course, if we're talking about having to build a latrine that costs between $400 and $700, it's impossible for them to, in their lifetime, to be able to do it. And their priorities as well, if they're going to borrow money, one of the first priorities are going to be investment. The second priority will be education for the children, and the third priority probably will be sanitation. So 20% of the population cannot afford to build their latrines in Ghana. In this next slide, as part of the emerging lessons, we concluded that not all rural consumers have the same willingness or ability to pay for water and sanitation products and services. Again, going back to this pyramid on the left side, where we have the 4 categories, this time is a little bit more explicit. On the bottom layer, on the bottom line, on the first column, we see public subsidy for consumers. For people making less than $1.90 or $2, public subsidy for consumers is necessary. These are households or individuals who wish for water and sanitation services, but do not have the means to pay for these services. So on the blue balloon, pro-poor guidelines to support persons in this category are needed. So subsidies is required on this category. For what we call the middle income, consumers rely on credit for water and sanitation. The households are willing to pay for water and sanitation, but rely on credit for products. These category will require, if there's any availability of microfinance institutions or BSLAs, groups to provide those kind of loans. And at the top row is consumers that pay in cash. Households that depend on their own income to pay for the services, and they might able to afford, but in some other cases, some other instances, they might need to request for financing. In the sanitation field, our concentration will be on the expansion and strengthening of the supply chain sanitation products, and continuing the development of a core inclusive market that provides an integrated and durable solution, as well as scale up the production and distribution of affordable, durable, and resilient superstructures like the picture in the lower right. You can see the blue door where it has been built with bricks that are new technology that we're testing, that the whole superstructure will cost maximum $100. And on the left side, you can see what we call the Digniloo. In 2019, I made a presentation about the Digniloo. It's another solution, a latrine that costs less than $100. So for about $200, the individuals, the households should be able to have a decent latrine that meets all the standards from the government of Ghana, as well the SDG number 6. Another key aspect for us is to support the supply chain and distribution of menstrual hygiene products as part of the menstrual hygiene management in our implementing, along with our implementing partner, Bigro. So on these pictures, you can see some of the innovations that we have brought into the program. The supply chain, as you can see the picture in the middle, showing the Digniloo distribution, which we are creating a network of micro entrepreneurs to reach the last mile and make it more accessible. That's another way to close the gap, not only from the finance side, but also from the product side. If we can make the cost of the products lower, then people will be willing to take a loan for something that is more affordable. If I translate that into university, it's not the same thing to have a tuition of $80,000 as much as they can get a scholarship of, I don't know, 30%, still unaffordable. So it's the same case at this level. So this is where we're trying to lower the cost, to bring the cost as much as possible down. The next steps under enhancing WASH. Going forward, we will continue working with the private sector, like the company Duraplast that is manufacturing these Digniloos in country with local labor, paying taxes, contributing to the economy of the country, we will also put more emphasis on the governance by supporting the Ministry of Sanitation and Water Resources to disseminate the pro-poor guidelines that we also support during the WASH for Health program, where establish a mechanism for those who cannot afford to build a latrine more, it's more equitative in terms of access to determine who really needs those subsidies or targeted subsidies, and without disrupting the market of the sanitation products. We're rolling out the implementation of an expansion of different models to operate and maintain small water systems. As a result of that, we have established partnerships with Water4 and Safe Water Network, which they will be presenting next, to professionalize the distribution of water systems, which under Wash for Health, we have piloted 3 different mechanisms. One was run by Community Water Sanitation, which is that's government. We also did the community-based management, which is what we call the community-based community water sanitation teams. And now we're bringing the private sector to manage those systems. So we will be able to compare the 3 models and to see the efficiencies of all 3 and try to professionalize and increase the expansion. So now I will hand over to my colleague Joseph Ampadu, who will be talking about the water for Safe Water Network. So thank you.
Thank you very much, Alberto. My name is Joseph Ampadu Boache. I work with Safe Water Network as head of partnerships for Safe Water Networks program in Ghana. Safe Water Network is a non-profit, non-governmental organization that's investing in locally operated safe water enterprises. Our objective is being able to demonstrate the opportunity for using enterprise solutions for delivering sustainable, safe water. My presentation will focus on, and again, it builds on what Alberto has just shared with you, what the financing gap is as far as the capital expenditure is concerned, the ongoing operation and maintenance, and then what we will be doing under the Enhancing WASH program, along with other partners to be able to bridge the gap. So the slide you see in front of you describes what the gap is, and the need and the gap indeed is very huge, especially when it comes to being able to work towards the target of delivering safely managed water access to every home in Ghana. Currently, collectively as a country, we're doing about 40% coverage in terms of the SDGs. Again, when you break this data down into rural, urban areas, there's a lot of disparities. So the rural access is a bit more lower than what you see collectively as a country. But then that reinforces the need for a huge capital investment to be able to expand access. Unfortunately, we haven't done too well when it comes to providing the CapEx infrastructure investment to be able to bridge this particular gap. So clearly, if you look at the annual CapEx funding required, which is around 327 million, we're currently doing, and I think this is the situation over the last 3 to 5 years, where we are doing around $79 million, and leaving a huge gap of $247 million, which is just about 75% of the annual CapEx that is needed if the objective is to be able to deliver basic water services for all. So that is with the financing gap when it comes to providing the infrastructure to deliver the services. In addition to that, we have a gap when it comes to being able to cover the ongoing operation and maintenance costs. And again, the information that is being shared with you is based on the output of work done by Safe Water Network, based on the performance of our portfolio of 91 water stations. And clearly you can see that water service providers in Ghana are unable to collect sufficient revenue to cover their ongoing operation and maintenance costs. So again, you can see our revenue on the extreme left, and that is enough to cover the local operating expenses at each of our stations. And by that, I mean the very basic costs in terms of electricity, chemicals, equipment that are needed to be able to treat water, and then also for the salary that operators need to be able to turn up every day and run these water stations. But then when it comes to the ongoing program support, to be able to supervise these operations, to ensure that we are providing water quality testing, to ensure that we are providing ongoing program support, the revenues are not sufficient enough to cover all these expenses. So at the station level, we have 100% cost recovery, but then collectively, if you add the field service cost, which is needed to keep this portfolio of stations running, and then you also add an allocation for maintenance reserve. And of course, we need this because these are machines. Anything at all that operates will break, and you need a reserve to be able to fall on that. Then collectively, the revenues are enough to cover just about 43% of the costs. And the reason is not far-fetched. We operate in very challenging geographies. Incomes are low, averaging $2 to $3 a day. You want to be able to balance financial viability with equity and inclusivity. So for good reason, you have to charge tariffs that are realistic and affordable for the large segment of the market. But again, this is the gap that presents a challenge for our work, and we are working towards being able to reduce this. So how do we want to be able to reduce this gap and enhancing WASH? And again, this is not entirely about Safe Water Network. It's about working with other partners within the consortium to be able to do this. So within enhancing WASH, we are expanding our field operations into the northern part of Ghana. And for those of us who are familiar with northern Ghana, it's a very challenging geography. It's one of the areas that are poverty endemic, face very challenging situation in terms of access to water. So we are looking at expanding our model into this very challenging geography. We are looking at investing in an additional 5 optimized pipe connection stations. And I emphasize household pipe connection because we've seen convenience as a key driver for sales or when it comes to consumption of safe water. Wherever we provide pipe connections into homes, we've seen consumption go up as high as 4 times. So if this happens, we are in a position to be able to get more revenue from consumers to be able to deliver a much more sustainable service and break the gap. The other additional thing we want to do is to have these stations equipped with solar power. Solar not only ensures that you have a reliable service, we are also in the position to be able to reduce your cost of electricity by as high as 20% of the overall operating costs. So we'll be deploying solar. We again want to deploy mobile money payment technology so that it becomes much more easier for our customers to pay for their services. We also want to deploy prepaid technology. Again, with evidence suggests that once you have these convenient payment options, you are able to incentivize customers to pay their bills and have water services delivered to them. And then to be able to reduce the cost of our field teams visiting our stations to keep them running, we are deploying a digital operating platform so they are able to monitor the performance of our portfolio of stations in these areas. And also, without necessarily having to travel and be physically present every day in supervising these operations. We recognize the fact that it's a very challenging geography. We wouldn't want to leave anybody behind. So within the context of what we are trying to do to reduce this financial gap, we wouldn't want to distort the market. So we want to be able to pilot implementation of a targeted subsidy program. We are familiar with most utilities introducing lifelines. Evidence suggests this hasn't worked. So we're working again with some of our consortium partners to better define an objective way of being able to identify the poor and be able to deploy subsidies. Is it going to be a connection-based subsidy? Is it going to be a consumption-based? We will define all this and test that within this program. We wouldn't want to keep all the lessons to ourselves, so we are open to enabling and assisting others so they can take lessons from what we are doing under this program and incorporate it into their work program. So again, under enhancing WASH, we'll be providing training for actors, especially at the community level who are managing community-based water systems. We are looking at being able to train district level staff on some of the best practices that have worked for our model so that collectively, we don't just achieve success for ourselves, but one that impacts overall water service delivery in Ghana and of course in time across the developing world. So basically, these are the measures we are putting in place to be able to reduce the financing gap and ultimately being able to ensure that we have a sustainable water services. I think on this note, I will pause and turn it over to my colleague from Aquaria, Joyce Kisengani, to continue with the presentation. Thank you.
Thank you, Joe. My name is Joyce Kisengani from Aquaria. I'll be building on the evidence that Joe just shared on the gap between cost and willingness to pay. So within the Enhancing WASH program, Aquaria will be conducting applied research on interventions that partners are implementing to support rural wash service delivery. And so for this particular session, we'll be focusing on 4 main research questions on how much are households willing to pay for rural water supply and sanitation, and how does this vary with settings, with wealth, access levels, service quality, and payment modes. Then we'll be tracking operations and maintenance costs over a period of we'll be tracking operations and maintenance costs for the water suppliers within the north over a period of 3 years. Then thirdly, we'll be looking at evaluating interventions that can be able to fill this gap between willingness to pay and costs. And for sanitation, we'll be looking to evaluate incentives that can be able to bridge that gap. So right now, I'll be providing evidence from some of the work that Acquire has been doing in Southern Ghana that was funded by the Hilton Foundation on the gap that exists between cost and willingness to pay. So preliminary results from 4 systems that we've been monitoring over a period of 1.5 years. These are small town water systems in Southern Ghana that are community managed, show that these systems are not able to collect enough, do not collect enough revenue that can cover their expenditures. So as you can see from this table, only 1 system here is able to meet their expenditure based on the revenue they are collecting. And if you dig deep, you will see that these expenditures and revenues are very variable based on a monthly basis. So you can see here, sometimes this system is able to meet its expenditures, and sometimes, most of the time, it is not. So we conducted household willingness to pay surveys with users of 2 of these systems to find out how much more would they be willing to pay for improved water service provision. So that is having water that is chlorinated, safe water. And we found out that for standpipe users, households will be willing to pay an additional $0.2 per meter cube, in addition to what they're currently paying, $0.6 per meter cube. And then for private household connections, households are willing to pay $0.07 per meter cube on top of what they're currently paying of $0.4 per meter cube. But still, if you look at this, it will still not be able to cover the operation and maintenance cost for these providers. So I'll now introduce my colleague Philip, who will dig deep into the models that we can use. Thank you.
Thank you, everybody. My name is Philip Deal, and I'm the Director of Ongoing Service Delivery at Water4. Water4 is working with 15 different companies in 9 different countries across sub-Saharan Africa, each of which are working in this rural water service delivery space with either hand pumps or pipe water systems. Altogether, they're serving about 3,750 water points and some 650,000 people. The company that we're going to focus on today is Forward Development West Africa. They're the company that's been in Ghana since about 2016. Their mandate at that time was to work in a rural district, about 90% of it, which is a population below 5,000 people per community, and completely provide access for that entire space. So over time, they worked through that, and it really gave us a great basis and groundwork to see what the different market segmentations are, what are the different challenges that you're going to encounter in different spaces, and what are the services you should provide at those different levels. So at this point in time, they are expanding with the Enhancing Wash group, and we're looking to double in size over the next several years as we go into the very west. So what were some of those learnings that kind of builds upon some things that Joyce was talking about for us? One was that willingness to pay can evolve. Even though this is a common tactic that we use to try to assess what people are comfortable with, it's rooted in a lot of the norms and expectations that they have. And so as we went across time, 2017 and 2021, we saw an increase from 38% to 50% penetration, which we defined as regular weekly users during that time. But this was context specific. If you went into each and every community, that could range between 20% and 90%, depending on competition, the norms that were set there, and really the motivations and drivers that were rooted in that specific set of households. Which is the last point I'm going to say here, is that willingness to pay is rooted in the value that they're going to put on your product or service. if a person in a person's mind, Apple, for example, you are a great product, they're gonna pay more for you, right? And if they have low expectations, they have certain norms, it could be the exact same product, but they're gonna pay less. And so for us, we really try to dig into some of those motivations. And the top 5 that we saw were in order of priority: distance, taste, appearance, price, and then water quality. When you think about this, yeah, water quality number 5, right? It's not that complicated. For me, I had chocolate cake at lunch today. I love chocolate. Is that the healthiest option for me to eat? No, right? It's the same logic that these people are applying, and we should not be surprised at this, right? So let's talk a little bit of strategy. With all this learning, Water Force tried to apply a number of different tactics to really overcome this barrier with the costs that we need to overcome for water service delivery. So I'm going to pepper through these, but really each one of them has a story, and I'm happy to talk through them. First off, we're taking a private build own operate model. That lets us move a little bit quicker through the government chains, for one thing, but it lets us really control what we're building, and we're incentivized to look at all of our water systems as assets. Maximize that asset because your salary is essentially dependent on it, right? This compounds with being able to control the supply chain for each one of those systems. Everyone looks very similar. Everyone is going to have the same components. So your technicians really get used to the nuances of each one of those parts, and the supply chain is easier to run. This is also tied to the economies of scale that come from this by looking at a specific region and making sure that you're not jumping from one part of the country to the other. And there's lots of examples of this, but one simple one is one technician can serve 20 systems instead of 20 different people having to be trained, qualified, and paid for each one. Prepaid meters, there's a lot to that, but simply put, you don't have to chase money as much. Life cycle cost projections actually put our prices higher than the norms. And this is the intentional. We're trying to plan ahead for the capital maintenance costs that we're going to have to do. And we've even seen evidence that the consumption and the household connection is actually the same at half the price, right? Blended financing is a point that I'll talk about in just a second. All this is couched in aspirational branding. You can see here, Numa Purified Clean Water is the brand that we use not only in Ghana, but in several other countries as well. And the blue kiosks that this signifies that stand out in a given community have an aesthetic that lets you know this is the quality you're going to get, this is the service you're going to get in each one of these locations across a given area. Every bit of this is focused on the customer. Tying back to those willingness to pay conversations, if you're not planning your messaging, if you're not planning the services to really target what people really care about, then you're not going to get the results that you want. So we're constantly looking at how can we be reliant and focused on those customers as opposed to donors or other things that may pull us away from what we really want to accomplish. Let's talk about that financing piece then. For us, if we're trying to serve hand pumps, kiosks and pipe stands, and public taps, and household connections, each step up that chain is going to cost you a little bit more per year per person. This is a rough, quick estimate you could look at if you wanted to serve 100,000 people, what it would take on a range to actually accomplish that. The more efficient you are, the farther down that chain you're going to do, the better you're going to be in position. This kind of leads to a conceptual framework that we've developed where we're segmenting the market. And I would say there's more segments than I'm showing here. But for simplicity's sake, you can see in this graph of green is good. You're feeling like you're getting your cost recovery or profit to that extent. And red is something where you're probably going to lose money. So when we look at that operation and maintenance cost, if you're in communities less than 1,000 people, you're probably going to be having a little bit of a loss. And the common approach is to just work in those rural markets. So what if you get a couple really good communities that are up there at the 5,000 to 10,000 range or even up to 50,000? You can get a base of revenue that covers a lot of the technician costs that you're going to have to do that helps cover that other end, right? And with regards to the upfront financing, we have obviously our limited donor base that Joseph was talking about, but then we have loans that we can access as well. And where should you apply that financing? Putting those grants towards those lower end communities is the smart play, right? And then as you go up the chain, it's going to be easier. You're going to get more or bang for your buck if you have a standpipe that's in a densely populated area. It's more reasonable for you to look at loans in those scenarios. So we actually applied this thinking. Over the last several years, we've taken about $260,000 in loans to put towards household connections. For us, if we can get that water system put out in the first place, and then there's no limit to our ability to expand those household connections, that really lets us push into that safe haven space. But that requires us to be able to take a loan out to accomplish that. So we did this approach. We have certain terms that were favorable to us, maybe 6% interest, some some currency devaluation protection was even in one of those. And when all was said and done, as we're progressing through, it's looking like we're going to be able to recover about 56% of that loan. Now what we want to get that into that. So last year we actually went back and looked at our household connection design, actually cut it in half, taking off some of the bells and whistles with tank stands and whatnot. And we brought it into actually looking at what this would project with our real consumption with real data. And this particular model that you're looking at right here is even looking in the upper west, which Alberto was saying is one of the poor regions in Ghana itself. And we believe that if we are taking about 25% of that whole system cost upfront as a loan, we can get about an 11% internal rate of return on that investment. All it would take is about $5.40 per person per year. And that's about 2% of the median income in that region. So we feel good even about that tariff level and being able to recoup these different costs. But there is still that challenge of overcoming those initial costs of those household connections, just like Alberto was talking about. So those loans that we were saying, so we take the risk on that is one approach. Deloitte will talk a little bit about some other examples coming from the customer side, but overall, we feel good about taking this approach into the region we go. So over the next several years, we're going to be expanding around the WA municipality. We already have MOUs with 4 different districts to work in those specific communities. And I believe there's 10 systems built at this point, and we're looking to get about 60 by 2026. So as we continue in this process, we look forward to actually sharing these units with you. We're going to look at our progress, we're going to look at our challenges, and we're going to look at our successes. And overall, as a group with Enhancing WASH, we'll really be able to give you a clear picture of what it takes to accomplish this goal that we're all trying to get to of rural water service delivery. With that, I'll pass it off to Anna with Deloitte. Thank you.
Thanks, Philip, and good afternoon, everyone. My name's Anna Schaefer, and I'm part of Deloitte, a team member on Enhancing WASH. For those that don't know, Deloitte's an international consulting firm with capabilities in finance, mobilization, policy, regulation, strategy, and market-based solutions. Now, Joseph and Philip both spoke some to Safe Water Network and Water4's respective business models to close the gap for water service supply. I'll speak to our work on USAID Ghana Enhancing WASH, where Deloitte's role is to support the program to implement new sustainable financing mechanisms to address rural WASH financing gap in northern Ghana. And this gap was previously mentioned in our previous sections. Actually, let me rewind one. And in this brief section, I'm also going to share with you some of the innovations that the consortium has already been engaged on under its predecessor program, WASH for Health, that Alberto introduced, as well as into the current program where we've just finished year 1, USAID Ghana Enhancing WASH. We'll also look towards the future and consider what else can be done to leverage innovative finance approaches to address this gap between costs and willingness and ability to pay for rural water and sanitation services. So I'm going to kind of organize this session into 2 different focuses, looking at gaps at the household level and then looking at gaps at the service provider level. So first, let's look at financing gaps at the household level and what's taken place under the predecessor program, Ghana WASH for Health, and what we're currently implementing and exploring under USAID Ghana Enhancing WASH. So first on the household financing gaps at the household level, these include, as my colleagues mentioned, funding gaps for attaining a household private piped connection, or conducting for a community to conduct a retrofit or upgrade a borehole, or on the sanitation side for the upfront cost for latrine materials and installation. Under USAID Ghana WASH for Health, as Alberto mentioned, the program provided support to small-scale water systems, began to or developed a Procore framework for targeted sanitation subsidies in coordination with the ministry, and partnered with the private sector to send latrine materials such as cement, vent pipes to communities via existing distribution depots. Now, under USAID Ghana Enhancing WASH, what are we doing and what are we looking at? We're currently working to reinforce village saving loan VSLAs, village savings and loan associations, and looking for ways to integrate sanitation revolving funds into these existing community savings mechanisms. We're also further making smart implementation of these Procore policies and targeted use of subsidies to not distort the market, but to also address those lower income households that are unable to reach certain services because of cost prohibition. And at the community level, through VSLAs, we're looking at opportunities to pool financing so various communities can achieve a greater economy of scale in the amount of funding that they're able to access. And we're considering how we can do this as well through credit unions and microfinance institutions that are typically have interest rates that are out of reach for many populations. We're also considering the potential for loans offered from service providers. And one specific example to kind of showcase this is a revolving fund in Côte d'Ivoire that I'll speak to. And actually, this is not in the water sector. It's part of the energy sector, and Côte d'Ivoire, Ghana's neighbor, has a similar challenge for achieving SDG 7, which is universal coverage for electricity access in the country. Similarly, those areas that remain uncovered are typically more rural areas and also households that have lower income levels, both urban and rural. And so in 2014, what the government established in order to achieve their respective SDG was a revolving fund to subsidize the upfront connection cost for electricity. And eventually, with each invoice payment or electricity payment, the user could pay down the total cost of the connection. I understand that this may be also an interesting concept that Ghana Water Company Limited is looking at for piped water connections in urban areas, and be very happy for Mr. Stephen to speak a bit more about that experience later during the discussion. So here's one example, looking at considerations from other sectors of how we can learn and adapt over the next 4 years on our program to close this gap. I'll buzz through this for time's sake. Now let's look at the financing gap at the service provider level. So we'll look at both what's been done under the current program and what's been done under the predecessor program and how we're addressing this gap. So first of all, what is this gap? As we mentioned, the funding gap at the service provider level is for long-term capital expenditures, investment planning, but we also recognize, and it was cited, that your regular O&M costs are also challenging to achieve cost recovery on. Under the predecessor program, USAID Ghana for Wash for Health, the program began to support setup of small-scale water systems, as I previously mentioned, and train community water and sanitation management teams as the structure to manage these systems. The program also sought to reduce supply chain costs for sanitation products through public-private agreements with cement companies, plastic companies who are manufacturing the product Alberto mentioned previously, the Dingiloo, in country. Now, under USAID Ghana Enhancing WASH, we're building on the work started under USAID Ghana Wash for Health. The program is already reinforcing mechanisms like BSLAs and working to establish sanitation revolving funds, as I mentioned. These can support both households and SMEs and small scale service providers. We're also looking at how to leverage credit unions and other microfinance entities to use group finance or implement guarantees for multiple SMEs to start or scale their businesses. And finally, we're working at the local level to strengthen the enabling environment to allow more private sector engagement into the sector and making policy guidelines more clear for private sector to engage at the local level. Last but not least, we're piloting incentives that seek to break down market barriers to entry. One thing that we're also considering is in the next coming years, how to leverage climate finance, whether that's possible, into our work in the water sector. And this is something we would welcome further discussion, learning in the next 4 years, and would love to hear your feedback as well. For the sake of time, I will stop there and summarize, and we can answer any questions of pieces that we didn't cover. So in summary, I've just presented some of the financing approaches the USAID Ghana Enhancing WASH program is considering in parallel to operational approaches that Joseph and Philip mentioned to close the gaps between cost and ability and willingness to pay for both rural water and sanitation services. We've just completed year 1 of this 5-year program. So over the next 4 years, we will continue to utilize our applied research and learning to identify the most effective financing and operational approaches to close the gap. And thank you for taking part with us to learn and share your experiences during the discussion as well as during the breakout sessions we have to follow. And next, I'll hand over the microphone to Caroline in case you want to cover anything else to summarize. Thank you.
Thank you to all of our speakers. I'm actually going to invite you to come forward for the panel. I'm also inviting Nikki Venka from Program Specialist at USAID to join us. No, please.
No, there's 5.
There's 5.
Okay,
Yeah,
okay.
thank you. So this is our opportunity to ask questions to the presenters, and I thought I would kick us off with a question for Nikki, USAID, if you don't mind. So we heard very eloquently that there is a financing gap, not just for CapEx or infrastructure, but for operation and maintenance or OpEx. Aid traditionally focuses on infrastructure investments, and I was curious to hear from you what USAID is considering as strategies to support O&M as well, since there is a funding gap there too.
Yeah, definitely. Can you all hear me in the back, or do I need to do that? Okay. I'll
There's a
project.
microphone here.
I'd rather do that, honestly. So,
Wait,
oh,
Use this mic.
good point.
Yeah.
Thank you. Okay, is it on?
No.
They can hear the recording.
They can hear it on the recording?
This
Okay.
ally should be.
Okay. So USAID actually is really moving away from the kind of one size fits all infrastructure, like CapEx heavy investments, and we are advocating for a shift to an area-wide approach. That really meets service providers where they are and has tailored interventions rather than, just, as I mentioned, the one-size-fits-all capital investments. And so part of that area-wide approach, as I mentioned, is meeting service providers where they are. And a problem with that is that a lot of service providers are not achieving cost recovery. So how can you expect service providers to be able to have the funds for operations and maintenance if they are hemorrhaging money? And so sometimes that involves, strategic investments in capital maintenance, replacement. That's if you really just have to stop the bleeding. And then in other cases, we really focus on operational efficiency, and that can involve investing in customer management systems or PR even in some cases, and really just helping these service providers to become viable businesses. Because at that point, you can't expect an investor to be financing a business that is hemorrhaging money. So we try to kind of lift up these service providers through promoting different systems that create operational efficiency and allow them to stand alone.
Thank you.
I think there's a question.
Yeah, I'm inviting questions
Can
from.
I follow up on that? Because I was in Ghana last week. And I talked to a bunch of service providers and all of them have had their price eroded in dollar terms because of inflation and devaluation. And they may have started out at a point where it was more or less okay, but now it's really not. And so it's sort of hard to square what you're saying with what their experience is, which is that, and a lot of their costs are in dollars. So I hear what you're saying, but it sounds very different from what the folks on the ground are trying to do to flip.
He has a good response to that, it says.
Yeah, Alberto and I were actually just,
Turn it on.
let's see.
I think it.
Maybe it's dying.
Uh,
Alberto and I were actually just talking about this, Louis, at lunch. And yes, the currency has dropped from about a 6-to-1 ratio last year to 14-to-1 today.
Wow.
Right. And it has actually traditionally been relatively stable, but when that happens, the challenge for especially utilities is the tariffs have been set. We've got those regulations and we've got that cap, and the quickness in which it can be adjusted in situations like this is too slow. So that's actually a situation, we were listening to Ava earlier today, where they're kind of flying under the radar and they're even avoiding to some extent some of those regulations so they don't get stuck in that trap. There's almost a necessary flexibility there to go around that tariff when you need to actually price adjust where things are happening. Statute Water, which is very common in Ghana, already increased their price from 20 pesos to 40 with the change that's been happening. And if a service provider can't do that, they're stuck. Right. So,
Thank you. Oh, Anna, you have a response.
No, I just want to snowball a question, but please go ahead first.
Well, either way, I mean, you can go ahead, but.
Thank you. So, well, this doesn't work, but I'll hold it for show. Philip, you mentioned rising costs in Ghana, same as the individual in the crowd. And I think one of the key rising costs as well is energy costs in Ghana. How have different business models been able to maybe reduce reliance on the high cost of electricity from ECG or your other utilities in the north?
you can go first if you want.
Well, I think as I did indicate, not only do we find the service unreliable, wherever we've tried it, we see a significant reduction in the ongoing costs. So again, we see that as an enabler if we really want to deliver a sustainable service. But talking about the precarious currency situation, again, it's impacting our operations significantly. What helped us was we rode on the back of a recent price increase by Ghana Water Company. I mean, they had tried to subsidize operations for a while. It got to a point they just couldn't. So I think they announced about a 30% increase. And on the back of that, we had a conversation with our local government authorities to be able to implement some price adjustments. Unfortunately, just as we did it, within the space of 1 to 2 months, we've had a huge jump. I mean, our currency has depreciated drastically between August and now. I think we've lost almost 40% of the value or so, and it's just getting worse. So again, it's really impacting our operations. The good thing is that we, as part of our model, we've maintained a transparent reporting procedures with our local government authorities. So once you're able to engage them with the evidence, they are sometimes open to allowing you to make some price adjustments. Again, we also have challenges when it comes to coinage and things like that. So in Ghana, you cannot implement very simple, modest changes in price to account for inflation and things like that. If you're looking for a 5% change, I bet you wouldn't find it. You have to always round it up either to the nearest 10 or to the nearest 20. And that also poses challenges when it comes to being able to do that. But again, the good thing is leveraging digital technology. If you're able to get most of our pipe connections on prepaid meters, then we can make very, very simple changes in price, and consumers wouldn't feel that impact a lot.
Thank you. Rachel, you can ask your question.
Thanks. I'm Rachel Peltz from the Quiet Institute. Thanks. This was a great presentation. I actually had 2 questions. So first, I would love to hear about how the free water program in Ghana has affected the economics of rural water supply. So many of you know that the government declared that nobody would pay for water at the start of COVID, and I think that lasted at least a year. So curious to hear kind of what's happening now on that. And then I'd also love to hear from Anna about climate finance as well. So thank you.
Sure. So that's true. And it was, I think, May and June, and we had a break in July. And it jumped back in for 6 months in, was it 2020 or 2021?
2020.
2020. And, for us, Water 4 can act as a buffer for that, and that helped, right? But essentially, the government assured us that we would be repaid for whatever we sent out. We've probably gotten, I don't know how much you guys have gotten.
15%.
Yeah.
In average, they got 15%.
Yeah, 15%. So certainly nothing that we could count on, but if you don't have that back support, you just would have been in a complete disarray. Would you agree with that?
Yes, I agree with that.
Yeah.
I agree perfectly with that. We provided free water for close to 13 months. We've only been paid for 2 months. All our invoices are with government. We have been assured that with time we will be paid. For us, we took one decision, which of course has helped reinforce our model. We decided that we will, for areas where we are operating, we will encourage households that have household connections to continue to pay for the water.
Yeah.
And then for all the other residents who are fetching from the public standpipe, they can get it for free. Interesting enough, throughout the free water program, demand for water through the household connections rather shot up, which meant that people will still value convenience. And again, it reinforces the point you shared this morning. That people will almost always they will value their convenience when it comes to accessing water services. So that was one big lesson we learned. But again, of course, I mean, with depleting revenues, it impacted on us.
Great, thank you.
The depleting revenues impacted on our operations. So as part of our cost build-up, we've introduced an additional reserve where we are looking at being able to deploy part of our maintenance reserve into an emergency fund, because we don't know when the next emergency will strike, where government will again introduce another mandate and compel us to be able to deliver free water services. And again, we're able to sail through this with support from our partners and funders. Without them, I'm sure 3 or 4 months down the line, we'd have had to shut down our operations.
If you want to hear more, there's actually a paper out on it that we can refer you to.
The question for Anna.
Oh, sure. Thank you for the question on climate finance. So this is something that we are going to be considering in the next years of the program, its feasibility, viability. As we know, climate finance has been traditionally reserved for the energy sector, but the water sector and water itself will continue to be impacted by the effects of climate, and especially in northern Ghana, water supply will be threatened by climate, and we're seeing sort of already desertification, water scarcity, irregular rainfall, those types of effects that can upset infrastructure if it's not resilient. There's two main types of climate finance, mitigation finance and adaptation finance. I think in some ways, we're already practicing mitigation on our program through reducing reliance on generated electricity, usually heavy fuel generated electricity in Ghana. And we're using solar for pumping and various electricity costs. That not only reduces our operating costs, but also has an positive impact on reducing GHG emissions, which is a key criteria for mitigation finance. Adaptation finance is much harder to make a case for. It's there's a longer outset for it, and you need to demonstrate how your system is resilient to the impacts of climate. So for both forms of finance, climate finance operates through the central level, through Ministry of Finance and down. So as we explore, it would be looking to see how feasible it is to begin to align municipal investment planning with national climate policies in order to start to make the case for whether climate finance could be justifiable. Thank you.
Do we have time for more questions? Yeah.
Yeah, my name is Patrick Ward. I'm with Soil Haiti. And subsidies is something that we've been discussing within soil and something I've heard in the hallway, something that you guys have brought up in your presentation for several of you. I'm wondering, how do you plan to, or have you implemented any subsidies thus far? And how have you targeted these subsidies? Specifically in the case we were talking about less than $2 a day, but these are very informal economies, so it's hard to kind of keep track of those metrics.
Yes, thank you. Well, as part of the rollout of the Wash for Health program, we helped the Ministry of Sanitation and Water Resources develop some guidelines to identify the poorest of the poor. So obviously, if you walk into a community and you ask who is poor in the community, everybody will raise their hand. Everybody wants subsidy, of course. So, but something that is admirable in Ghana is the fact that from the chief, there's a very pyramidal structure. So talking to traditional leaders, chiefs, associations, women's associations, youth associations, they know who in that community they need support. So through that mechanism, we were able to identify and follow some steps and like fill a quick survey that those people who qualify, for example, women with multiple children without support, elderly people, handicapped people, those kind of people, they do have access to free water, for example, or have access to a subsidy for the construction of the latrine. And it's the same community who will build the latrine for them, and or they will help them have the access to water. So I'll be happy to share those guidelines as a model for Haiti as well. Yeah, I know very well Haiti. I worked before there for 6 years, so it's something that can be applicable there. Yeah, thank you. Sure.
Thanks. And one last question from the gentleman. Yeah, you.
Seth Wong, Water Mission, great presentation. I had a question about, two more questions. When we talk about independent finance, is the local government, county government, are they for the finance, investment? And secondly, I'm more curious about how you're structuring the finance. Is it a structured finance product, some commercial financing? You mentioned that you weren't going to really meet that first portion of the loan repayment. What's the recourse now?
Yeah, definitely. Great questions. So first question, is any of that part of the government? No, not at this time. So a very common thing that's done with public-private partnerships is that you can get some of that financing from the government. And at some point, you're then gonna turn it over after a 20-year term or whatnot, right? And we haven't had to do that yet to this point. That doesn't mean it's off the table, but certainly something to consider. So for us, it's been with social impact investors. Typically, it's been, like I said, something like 2-year grace period, maybe 5 to 7 years. And maybe 6%. And so we arrange those deals and it essentially runs through the enterprise, right? We've experimented actually running through us versus running through an enterprise, seeing if there's differences in incentives that are associated with that. But suffice to say, us controlling that risk at this point is all the different ways we're experimenting with actually using them. With the recourse of actually having to repay it, the company's still on the line and they're having to pay that. The way we operate, we're actually getting money both for projects and for operation and maintenance. And we actually have to dissect that financing to really understand how both sides of the business are doing. But it's gonna suck away from any money they're making on these other projects. And it's important to feel that pain because part of the idea of taking a loan is that there is pressure for you to be efficient. There is pressure for you to figure out how to run as best as you can. And doing this in the first place, we were happy to take on that risk because that let us see where we stand. So any next steps or any future investments, we can say, this is what we can comfortably take on based off of the demand we've seen from our previous work.
Thank you, everyone. I think it is time to transition to the breakout groups. Should I introduce the breakout groups? Okay, so we're going to break into 3 groups based on interest, I believe. So at the back over here, we're going to have group 1 thinking about how to scale up successful service delivery models, such as the ones Philip and Joe have presented. So scaling up. Group 2 over here is going to be talking with Anna about lessons, how to apply lessons from the electricity sectors in terms of closing the gap. So group 2 over here. And group 3 in the front will talk with MFA from Global Community about how to create equity in financing and pro-poor measures. So scaling up in the back. Feel free to stand up and direct yourselves to the one you would like. Scaling up, electricity, so forth.
Your face.
Yeah.
Thank you.
Yeah, no worries.
Thank you so much.
Of course, yeah.
It's great, thank you.
I have one question, but
No, it's good. It's fine.
I'm just gonna.
Perfect.
No problem, so I can like.
Okay.
I don't know if it's gonna be.
Just like, so we have not, so we can share the question. So. Are we good to go? Yeah. All right, so how do we incorporate the sanitation plan in our business? So looking at how, just to get set the ball rolling, looking at how we can reach the gap between the poor and the rich, and then the poor trying to access finances for sanitation. In Ghana, we are trying to do the DSLA approach. But we all agree that with the DSLA approach, they basically say for businesses, their priority for sanitation. So how are we going to help them to start contributing towards sanitation?
Sorry, but just to bring everybody, I think everybody familiar with what the DSLA.
All right.
Briefing.
So DSLA is village service ongoing association. So basically, there are small groups in the community, about 10 to 30, that contributes in dates, depending on what they do at this point. Promote small business. So, but basically, because of this equity, we are also trying to add the money because of the saving. Now, with the presentation that was made, the question is, we want to bridge the gap between the poor and the rich, and also the poor be ready to pay for services, and then to also be able to access sanitation. Now, they don't have the money ready now, but then you have the existing village savings and loan groups in the community where they are there. So the idea of this, what you're thinking of is not sanitation. But what can we do for them to start contributing in that little group that they already have to access sanitation?
Here.
Everybody has to do. And then they themselves, they can go, they can take over the part of the money. And that's around here. Have any? So.
Once you are a member of the group,
I know.
the interest is very minimal, and they are never as 1% altogether.
So you're up here.
Over 6 months, depending on the agreement in the.
And what's the collateral?
The collateral is, they are each other's collateral, because they are the same community. So if you are not paying, the other person will have to ensure that you pay. So that everybody can take a turn to be able to borrow for whatever the purposes of the business are.
Do these also include a share out?
Yeah. I just want my hand for them to be able to have money or to have them to access sanitation services. We are thinking that those who you have to redefine their purpose of contributing. So instead of them to contribute for little businesses and women, we want them to contribute to be able to construct their latrine, or either to improve the one that they already have. So,
the loan is not individual, the loan is for.
no, the loan is for individuals. Individuals can go for the loan, but collectively, in the group, you have to contribute.
Yes. Yes.
If they are very committed, it becomes very viable. And we can tell them it's corporate.
So for my explanation, you saw the pyramid, there's all the that. No matter what they do, they won't be able to, even with all the way down to the BSLAs. This is meant for people who are making $2 and above, between $8. And that they will have access to the credits without having to go to microfinance institutions, which they will not qualify under the standard, the regular standard, the bank. So that is the part of the thing. But the mechanism the PSLA. Traditionally, you expand your or to create a micro enterprise, buy and sell little things. But what we're trying to do here is for instance, use the loan for the construction of the in this case. But also behavior change because they need to understand that what it entitles to do a lot is how it's going to impact on your savings. Because the money that you're going to save, you will not spend in medicines or having to travel to the nearby community. Where they spending time with doctors, etc. It translates, it has multiplier effects. The fact that they are saving in medicines and all that. So anyway, over to you.
But isn't it the answer?
Well, one, I said, I want us to brainstorm and see what are the other things we think we can do to make a small group contribute towards sanitation.
So, again, just to summarize, the SLAs are throughout all of Africa, some more successful than others. But all of them, the loans that people take out are for income generating activity. Correct. So I would like to get some ideas from you of how, what can be done to also get them to borrow for sanitation. I would add that this is the same question that just was proposed, it's not a finance institution. We don't like to loan for anything that isn't generating, isn't explicitly generating.
And then you start.
So your ideas is what we'll.
Yes.
So I'm just thinking of integrating approaches at the using for the investment platform for our business training. And a lot of that. So they have a higher profit on those three things. Take out for their small activity. Understanding that, maybe, I don't know. I can't remember if the SLA is conditional loans or not, so I can't remember, but they put it out in percentage and stuff. I guess what I'm struggling with though is just the length of time that it may take for them to think. First of all, to be able to pay out what they need to pay back.
So let's hold on to that, we'll come back.
Because it's a 6-month period, so it could be, 2 years, or we're not able to be able to still take that and pay a higher amount back.
The solution to that, I will come back.
Okay.
I think process in order to connect it with work. In order to certify the that they are and also bring some from outside another communities in order to connect commitments, some communities that they have some processes registering.
Okay.
Participatory process. It's not an issue for the outside of the space that bring ideas and want to share them.
So we try to do that. Try to, that existing PSLA that is very vibrant. So we try to ask them to, they have a constitution. What they want to do, what they don't want to do, that is binding on each of their amendments. So just to answer your question and just before you say, now we are trying to let them incorporate the sanitation thing. That when you take a bit of your money, if you upgrade the toilet that you already have, then you are qualified for the next one. We are piloting it in 2 communities, it's working, so we might have to transfer that knowledge of the cross-learning from that community to other communities. So,
I'm just wondering if you look at the gender dynamics in the household in terms of who makes the decisions for household improvements, and does it have a factor in the validation, the value of like saving or that or taking a loan out for sanitation? If it's not the one to do that, if it's a decision. I wonder if that might affect.
So that's all very fascinating because in the northern part where we are working, most of these decisions are taken by the men. So there's a gender part of those households where the men are part of the group. Through all the training process and the formation, and then we have part of the men as those who are going to be guarantors for the relationship with the girls to solve that issue.
But also, just to put you in context, but as the method explains, men not only live in the house, but they live. They traditionally they hold the money, go through that way. So they have cattle, the main income comes to them. And the small income, women are allowed to have small farming, like vegetables. And chicken, the women, but they are not allowed to own out. The men. So the women will farm. They will, the crops will go to the men, and the income will go to the men, and the farming, the revenue from the small farming will go to the men. But even with that small money, that is, their, the revenue, they are doing wonderful things.
I think also that sanitation, although it's for individual benefit. So I think also the community promoting, they should stimulate the people who don't have sanitation yet to invest in it, because it also benefit their areas. So that could also work as a mechanism that everybody will invest in sanitation.
So that's just what I said. So there should be a linkage between sanitation
And you're saying. They're trying to get kind of community to open education. It's not an individual, it's an entire community. And if one person has the house and build a maximum, then we now declare the entire community open. So that is very important, and that's the peer pressure goes, and there's a competition among themselves. Who builds the nicest thing, I can brag about that. So that's also. They are more, sorry, you wanted to learn their stability.
I think that's really that I think that one very I'd say, we also have a game point. And more of my say, they had a preference there.
So for the sake of time, let's jump to the third question, which is going to answer. Because the anyone and they can't contribute much. So the question is, do we all think that there's a need to subsidize or how much whatever they're going to contribute to help them construct their life within the shortest possible time?
Yeah.
You think so, why?
Because the trains are expensive and the BSLAs exist. And if they haven't been using the access to BSLA funds to build a toilet so far, that means that there's not enough demand or to accelerate that.
So that's a good point. So the willingness to pay is there. But the ability to pay that, it's not there because products are available right now.
But then it means that the BSLA can't work alone, right?
Right.
It's there, but the ability.
We need to bring these solutions that are available. So that, I was making that analogy with scholarships. With the university. Even if they give you 50% scholarship. it's still great. And for them as well. So the question is, okay, for you is like the co-funding or the matching contribution or the subsidy.
We want it should be there. For them to be able to construct their land.
Excuse me, I'm gonna ask everyone to wrap up.
Right?
No worries.
Yeah, that's what I want to take from the group. How do you think the subsidy should be? Because we know that they are not financial parents. But definitely, though they are duties, we still have to go much. So that they can. How should we apply so that we don't have to for that?
What means, it's complete, it's safe to and also, if you put them in the group, we are not a group that have 10 years. So sometimes, a good thing for one group would be impact, the negative, they are not saying, not saving, they are saying on something that is important, that I think for long-term family, also those from the
Decisions made.
So what about? Forward-looking out of beyond office.
Thank you, everyone. We're gonna wrap up the breakout groups now, and I'm gonna ask one rapporteur for group to share their learnings.
But
yeah, okay, thank you, everyone. We're running out of time, unfortunately. I think it was where that's just like, I'm saying that. This is my. Thank you for everything. I'm sorry. I know. I'm gonna call on the group in the back first. Would you mind bringing them? Yeah. Thank you. Yeah, very good. Great. So I'm gonna ask group number 1 to report first. The group with Philip in the back on scaling up. Do we have a rapporteur in the back? Oh, Anna is here. Thank you, Anna.
Okay, I'll do my best. So we sort of started with kind of a hypothetical example of if you were to start a safe water enterprise
what are the things to consider? So things like, what sort of management model would you use? What type of infrastructure? Looking at the types of populations that you would serve and, how do you make those decisions? And then we also had some discussion about considering the operating environment and the different funding mechanisms and contract types that might make that more or less viable in a certain circumstance. So thinking about how like a private sector partner really needs stability in order to be successful. So how can contracts be structured in order to give those operators that that's.
Thank you, Anna. We can have a rapporteur for group 2 on the electricity sector.
Good, maybe. Helping, is it working?
No, it's not.
It's not working. I said the first thing we noticed is that water and electricity don't mix, so we push that aside. But there's a lot of similarities. We thought the context of having a revolving fund to help with some of these household connections for water had some similarities. I think where we saw it would be really possible is where there was already maybe that major infrastructure that came into the community, a little more difficult in rural setting that does not have that infrastructure already there. There was also the thought that maybe it would be a better fund for some service providers as opposed on the household level. That was an opportunity we saw where we could take some lessons learned. But those are some of the two. We also noticed there's a little difference with maybe the individual's thought around water versus electricity, not necessarily being a basic human right or this idea of the competition. I think Philip, you talked a little about another competition, boreholes, water from the sky, all different things. That's maybe a little different context for electricity that would need to be worked through a little bit more, but a lot of good similarities that we could take from the energy sector into the water sector.
Thank you very much. Thank you. We have a rapporteur for group 3 on Pro-Core measures.
Yeah, so we talked through sort of using the existing VSLAs that villages have where women often take out small amounts, like everyone contributes into a central fund for the village that are part of these groups, and like women can take out small amounts for small activities that tend to be profit generating. And so we talked through ways that you could use those for sanitation and other aspects around that. And so we talked through like tying it a bit to health and improvement of health for everyone, so that it's not, so everyone in the community has an incentive who contributes to these to use the funding for those sources. And then also if folks are taking them out for another source, perhaps a percentage of it could go towards improving sanitation to be eligible to take out the loans for other things. And then we also talked through a bit of if there's a need for co-matching to be able to fund some of the VSLA components, and sort of as a group, we agreed that there likely is a need for matching or some external support to come to fund parts of these VSLAs, and that Pro-Core subsidies would be needed in that case.
Thank you, Valerie. And with that, so thank you very much for your participation. I hope the session was thought-provoking. I'm going to ask Nikki to give us closing remarks. Thank you, Nikki.
I'll be really quick because I know that the afternoon is tough. I just want to say it's really encouraging to see the amount of interest and the level of energy about this issue, especially right after lunch. And so just wanted to kind of reiterate that, the finance gap is a huge challenge. It's going to take all of us to work on, and it's really more of a finance or a governance failure than it is a lack of available finance. And I think that's important to keep in mind. That's why we work with governments to try and increase public financing for water and sanitation, but also engage the private sector to bring them in. It's also crucial to build the creditworthiness of service providers, especially in rural areas where a lot of times government doesn't spend a lot of money on water and sanitation. And that includes improving tariff structures, reducing non-revenue water, increasing cost recovery, and building operational and technical capacity of service providers. I'm also really glad that we got briefly to touch on climate finance, because at USAID, we like to say that the climate crisis is a water crisis because so many of its impacts manifest through either too much or too little water. So we need to be thinking about how our investments in water and sanitation infrastructure and solutions are climate resilient as well. And kind of wanted to close with, there's a reason that the first strategic objective in the new global water strategy is strengthening governance, finance for the WASH sector. And that's because it really underpins all of the work that we do. And that's also why we have a target to try and mobilize $1 billion for the water and sanitation sector by 2027, and to strengthen 1,000 institutions in the WASH sector as well. If you want to hear more about that, USAID is having a session on Friday morning. We have a couple of global water strategy flyers here and in the front. Just wanted to thank all the presenters for your great work in Ghana and for sharing that with us. And I hope everyone enjoys the rest of the conference. Thank you.
Great.
5 minutes.
Down, this is Terrence and Natalie.
Great.
Know in advance. And we're gonna organize it. Somebody to read that. So I was sure that I did. Most of these guys. Thank you very much.
You're welcome. Okay, so yeah, I turned on for like a couple seconds, like a couple minutes, and then I turned right back off again. Thank you for your help, guys. About education. No, I was more operating. I don't have anything.